This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 update for October 31st, 2020. The numbers, as always, are pretty straightforward. 46 million cases worldwide and 1.2 million deaths. About 1/5 of them, 9.5 million cases and 230,000 deaths, are in the United States. COVID-19 is one of the top 20 pandemics in terms of total death in recorded human history and remains the third leading cause of death in the United States. In Tennessee, we've had 250,000 cases and over 3,000 deaths. Virginia's had less cases but more deaths. And the Appalachian Highlands has had about 70,000 cases and now, for the first time, over 1,000 deaths. The numbers have been growing pretty rapidly with a 3.7% increase in the past week. As I mentioned last week, I'm paying attention to four basic things: the continued growth and spread of the pandemic globally in the U.S. and in our region, the change in the pattern of deaths in Europe, growing uncertainty about long-term immunity to SARS-CoV-2, and the increasing lack of public confidence in our federal regulatory and public health agencies. In terms of this first one, we'll start with spread. In early July, this was the distribution of cases around the world. We color-coded them for South America, Europe, North America, and other. We've done the same thing this week and color-coded them again. And we'll put them side by side. And there's a couple of very important things. One, this pandemic continues to grow everywhere, and it is increasingly becoming a pandemic outside of Europe. As you'll recall, early on in the pandemic, the deaths were in China, then it moved to Europe, then it moved to the Americas, but now we're increasingly seeing it moving back into Europe. So again, an evolving pandemic worldwide. This is all of the cases that had happened in the United States as of August 13th. And now I'm going to show you the cases in the past 2 weeks. And what you can see is a very definite growing pattern of outbreak in rural America. This is an overlay that we put together from July 31st. This is where the cases were in the preceding 2 weeks. So by July 31st, it had already moved away from the large urban areas in the Northeast and was largely occurring in the Southeast. But watch what happens when we evolve this from late July to late October. What you can see is it moving increasingly into the urban areas, into the West, and into the Northwest. So an evolving pandemic. We've seen the same thing in the state of Virginia. This is all the cases that had happened as of August 13th, largely an urban phenomenon. And then you overlay the cases in the past 2 weeks, and you can see increasingly it's becoming a rural phenomenon. Tennessee is a little bit different. By early August, most of the cases were in the peri-urban areas. But in the last 2 weeks, it's been all over the state, though largely in rural areas. This movement towards rural areas could be a good thing in the sense that it may be moving, burning itself out in the large urban areas. We'll have to wait and see. One of the things that's of concern, and then I mentioned in addition to the spread, also the total growth, because this is really pretty important. What we've been watching is the percent week-to-week growth rate in the total number of deaths. And it's been coming down fairly consistently worldwide. But of concern is it's remained at about the same level now for well over a month, close to 2 months. In fact, it's been between 3.5% and 4% for 2 months. The reason this is important is the week-to-week growth rate tells you sort of how fast the epidemic is growing and whether it's burning itself out. So at a 0.5% week-to-week growth rate, for example, it'll take 2 years to double. But as you can see, the higher the week-to-week growth rate, the more rapidly it's growing. And at a 3.7% growth rate, which is what we've seen, the number of deaths will hit 2 million in about 3 months. And another million will be added in 4 months. So the pandemic is still growing worldwide. What we're hoping to see is a mature pandemic where it grows quickly and then levels off in terms of total number of deaths. In Belgium, up through the end of September, we had seen this nice drop, and the week-to-week growth rate was well below 1%. The U.S., we've seen the good drop, but it hasn't been coming down quite as low. So it's been 2.5%, where it's been about the last month or so. And in fact, for several months, it's been below 3.5%. At 2.5% growth rate, we'll expect 300,000 deaths in a couple of months. It's important to remember that this pandemic isn't a single pandemic in the U.S. As it is anywhere else, because you have states like New York, which are showing this mature pattern. You've got states like Florida that are slowing down, states like Virginia Tennessee that are still going up, and then states like South Dakota where it's exploding right now. In Virginia, this last week, we saw a 3% growth rate. It's been fluctuating between 2.5% and 6% pretty consistently. Tennessee, on the other hand, the number is quite a bit higher, suggesting that the pandemic is still growing in Tennessee, perhaps more rapidly than in Virginia, and Virginia more rapidly than the rest of the United States. In terms of the Appalachian Highlands, the numbers do bounce all around, but you sort of see this pattern coming down towards now been about 7%, about where Tennessee is. So we're seeing this continued spread into new areas and also growth week to week. One of the things that's quite concerning is the change in pattern in death in Europe. I mentioned that Belgium was sort of the model for a mature pandemic. But if you look at this tail end, you can see that in the last couple of weeks, it's been going up. There it is, in fact, 5.6% growth. That's considerable. This is just the last couple of months. And you can see that for months and months, Belgium was below 1%. Now it's growing at over 5%. It hasn't been at 5% for 5 months. And this is a pattern that we're seeing in almost all of the hard-hit European countries. They went up and then it leveled out. And now they've been seeing growth in the last couple of weeks. Now, this could be a temporary phenomenon. It could just be that they've opened up and the new populations are being infected, but it could also be the result of the viral mutation or what we perhaps are calling a new wave of infections. If that's the case, then some of our predictions have been considerably wrong, and that we're going to see a new spread into areas that have already seen the pandemic. So we're not seeing that in the US yet, but we are seeing it in Europe. On top of that, there's growing concern about long-term immunity. There have been documented cases in several countries, including the United States, where people have become reinfected. And recently, a large study out of England suggests that the percent of people with antibodies may decrease over time. Again, these findings may not be important, but if they are real, then it calls into question whether we will have a vaccine or even any type of herd immunity in the short term. Again, something worth following. And finally, the lack of public confidence in federal regulatory and public health agencies concerns me tremendously. Whatever happens, this recording is made before the election. Whatever happens in the election, we've got to make sure that we rebuild public confidence, because if the public doesn't have confidence in the regulatory and public health agencies, not only for SARS-CoV-2, COVID-19, but any future pandemic, we're in real trouble. So the bottom line is COVID-19 is still spreading widely. It appears that most new infections are occurring in areas that have not previously been impacted, like South America and rural United States. But there also appears to be a resurgence in deaths in the most impacted European countries. And there are some questions about long-term immunity and potentially a willingness to step away from science-based approaches to the pandemic. These are things worth following. For the moment, we have to continue to do the things that we know work. Avoid unnecessary crowds, wear masks, engage in social distancing, implement good hygiene, stay home if you're sick, contact tracing, quarantine, protect the elderly, and keep our eye on the data. If you're interested in an article just came out in JAMA about the use of masks and other low-tech. And it says, as countries around the world seek to safely reopen businesses, schools, and other facets of society, mask use in the community to prevent the spread of SARS-CoV-2 in conjunction with other low-cost, low-tech, common-sense public health practices will remain critical. Return to normalcy will require widespread acceptance and adoption of mask wearing and other inexpensive and effective interventions as part of the COVID-19 prevention toolbox. We've got to take this seriously, folks. It is not over. A lot more information about SARS-CoV-2 and COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to a mailing list, please let Jan Stork know. As always, I'd like to thank Melissa White for updating the data on these slides and Barry Young for editing, producing, and posting them. If you have any comments or questions, please let me know. I look forward to hearing from you. Thank you very much.